In a society where social, cultural, and religious beliefs are barriers to sexual and reproductive health, the state government is keen on improving this aspect of human life through awareness and adequate access to sexual and reproductive health products. It believes this will help women and girls freely control their own bodies with modern contraceptives. Zainab Akonde has more on this.
No, I will come back.
In Nigeria, conversations around sexual and reproductive health remains a topic people are not comfortable talking about. Youth are not left out as they shy away from these discussions because of the stigma they might face for sharing their thoughts. Myths and misconceptions about contraceptives and other sexual reproductive products is an eye-opener to intensify efforts in raising awareness.
Contraceptive especially for women, to prevent pregnancy or to control childbirth. To my own belief, I think maybe the Western world want the Africans to reduce the population of Africans. Maybe that's why such thing is being introduced.
But some people are comfortable to talk about their knowledge of sexual and reproductive health and how it has impacted their lives positively.
Family planning is very good. It protects a woman from getting pregnant against her will.
You can say the economy. The economy would teach you that you should do what? You should be careful. It is advisable to whether family planning or contraceptive, whichever way that is good for you. But you have to seek advice from the expert.
According to a report by the National Demographic Health Survey, the use of modern contraceptives among 15 to 49-year-old married women is about 12% compared to a global average of 54%. This survey explains the low demand for sexual and reproductive health products among women in Nigeria.
We are surrounded by people who have sexual and reproductive health organs and they're not taken care of, and this leads to the untimely death of a lot of women and children across the country. And a lot of these deaths are very preventable with the use of different interventions.
Cultural norms and religious beliefs has been identified as a barrier that affects the awareness of sexual and reproductive health.
People still have thinking, and that you taking up a contraceptive method, you have some some issue with with fertility. No, they are just giving you a chance to decide when you can have kids and how many kids you can afford to to take care of.
The Lagos state government says it is committed to more awareness about sexual health and inclusivity among women with disabilities.
When it's time to go out and do screenings and do community awareness programs, we also want to go to where we have them having their meetings, so we go into where they are to ensure that we bring information to them. More importantly, we've also trained our health workers on how to respond to special groups, people living with disabilities, the young persons, the adolescents who have special requirements, on how to ensure that they get access to care when they walk into any of the facilities.
We researched and discovered that part of the major bottleneck was the logistics support to take all these commodities from the local government store to the various service centers. So what the government approved is the last mile distribution, which is what we do now. And what that entails is we get a third-party logistician to take the commodities right from, the state medical store.
They believe this awareness is the first line of action in ensuring a safe space where people can express themselves freely and use sexual and reproductive products with no shame. Zainab Akonde, TVC News, Lagos.
Let's go to Enugu State now, where Mr. Peter Mba, the governor, has sworn in 20 of the 21 commissioners that will constitute the State Executive Council. The governor charged the commissioners to fulfill their duties as the administration was in a hurry to deliver on its campaign promises. Bamidele Ajayi reports.
in an effort to assemble the caliber of personnel that will key into its agenda to transform Enugu to the most viable economy in Africa. Governor Peter Mba has inaugurated its Executive Council members. Enugu State Governor, during his assumption of office, promised to inject disruptive ideas in business of governance. A promise to move the state economy from current $4.4 billion to $30 billion within 4 to 8 years in office. This may have propelled the choice of these technocrats to form the State Executive Council members of his administration. The State Solicitor General administered the oath of office and the oath of allegiance on the commissioner nominees.
I will discharge my duties to the best of my ability.
Governor Mba, who highlighted his expectation, charged the appointees on the task ahead to deliver a safe, secured, and prosperous Enugu State.
We also promised our people to eradicate poverty. We want to make Enugu State the premier destination for investment. Those are laudable and lofty ideas. But one thing we knew also when we made those promises was that we needed the people to be able to convey our people from where we are today and that destination we want to take them to.
The new commissioners expressed their readiness to work with the state governor to build a state that the residents will be proud of.
I wish to first and foremost thank His Excellency Dr. Peter Mba for the opportunity he's giving us from the village setting to the State Executive Council.
And I strongly believe that we'll reserve no resources in ensuring that that particular mantra is realized, because the character of His Excellency is such that the determination is there to do that.
4 old commissioners were among the 20 newly sworn-in State Executive Council members, with 3 women. Bamidele Ajayi, TVC News, Enugu.